People call me a space cowboy.
Eric, it's
All right.
3:30.
It's 3
All
o'clock.
right. Well, I'll give folks just a couple more minutes till 3:32. We'll get started. I see Joel Sachs is in the house, so that's great. Our guest is. Appreciate that. Joel, if you want to unmute yourself and give yourself an audio test, that'd be great.
Yeah, how's this? Can you hear me?
Yeah, perfect. Thank you.
Okay, perfect.
Yep. We'll get started here in just a couple minutes. Now that the witty banter has slowly subsided on a Friday afternoon. I don't know how witty it was, but it was somewhat of entertaining.
Well, it was banter.
Yes, it was.
It was banter. I know. I see a very distinguished looking council member from San Juan County, recuse. Yep, laid back. What actually is in that?
Water.
Vodka?
Clear.
I don't know.
Clear.
Well, it's clear.
I wish it was alcohol, but if I had a drink now, I'd be asleep in like an hour.
Well, there you go, Jim.
Yeah, that's a little weird. That may have backfired. Ooh, how about that one?
Yeah,
Ooh,
that's the same one as Wes. Yeah.
Yeah. You can't have two of them in outer
Oh my
space.
Goodness. Okay, well,
Just have to stick with the real deal for now.
I guess so.
It's a whole new business
All right.
line, Eric, that will have tech support for Zoom meetings.
Yeah, that's true.
Mm-hmm. We actually, Mitch, you want to tell? We actually have we have classes planned and you might have saw those. We actually announced those classes on Zoom 101 and 201, I think, right, Mitch? Something like that?
Yes, sir. We created a Zoom 101 document, which is a 2-page document on how to attend Zoom. And we are mid-creating Zoom 201, which is probably going to be another 2 to 3-page document on how to host Zoom meetings and webinars. And we, in the Insider, which just launched, the monthly publication, email publication, we advertise you can sign up for those trainings, either one of them or both, if you'd like.
Okay.
Very cool.
Like it.
Yep, and that's been on one of our, I was actually was that in the Insider or Friday 5? I can't remember which, Mitch, we announced those in.
It was not in the Friday 5, but it was in the Insider.
Yeah, okay. Great. All right, well, let's get started. It is, 3:34. Happy Friday afternoon. Hope everyone is doing well and safe. Jamie Bodden has a well-deserved Friday afternoon off. I think this is actually her first Friday afternoon off since around Christmas time. So
Wow.
She is taking a deserved time off, just a half day. I've actually encouraged her to take a little bit more, but she was on calls with the public health officers as well as our solid waste folks this morning. So she's taking some time off. So you won't get a COVID-19 update from her per se. We do have you'll be getting meeting invites for next Monday at noon and Tuesday at noon. We're going to do some quick lunch hour meetings, one on coronavirus relief funds and one on variances. So we will be doing those calls next Monday and Tuesday at noon, and we will send those meeting invites out here shortly. So we'll remind you that we've got that opportunity that will be coming up specifically. And we'll we should have some time for a roundtable on those issues as well after this, depending on how many questions you have for Joel Sachs. So Joel, I think you're unmuted, but Joel has been the Director of Labor and Industry since 2013. He also served as a Deputy Commissioner for ESD and has worked in a couple of other agencies as well, dealing with employment matters. He's well versed in those. We asked him to talk about L&I's involvement, rulemaking guidelines. Clearly, there's a lot of questions around mask and masking, workspace, cubicles and plexiglass and all sorts of things associated with that. And it's probably right behind or right after coronavirus relief funding and how folks are spending those dollars. I think the number one question that I have been getting or comments is around masking in particular. So Joel, you probably want to cover that and probably be prepared to deal with that. So anyway, there's a number of different questions that are going to come up around that. So thank you very much for being here. And Joel, we'll leave it to you to kind of make some remarks and share anything you'd like to around the role L&I has in COVID-19 and rulemaking and the work you all are doing in regards to workplace safety. And then we'll have, I'm sure, undoubtedly a number of questions from both the county commissioners, council members, and I know there's some county administrators and public health and HR directors on the call as well. So Joel, take it away.
Great, thank you. And Eric, can you hear me? Just testing audio again. Okay,
good.
perfect.
Thank you.
Okay, great.
Yep.
So first, I want to thank you very, very much for the invite, and my hat's off to all of you in the roles that you're playing across the state. I think all of us that have made a commitment to public service and the variety of roles that we play, I don't think any of us had ever envisioned that these would be the kind of things that we would be forced to deal with. And I'm sure you've all been putting in incredibly long hours and are on the front lines answering lots of questions from so many of your concerned citizens. So I appreciate the challenge of the work that you're doing, both in providing services, trying to calm the fears in all of our communities, and recognizing moving forward to some of the budget constraints that we're all going to be under. So I appreciate the chance to be able to share a little bit about what we're doing from the state perspective, particularly from the labor and industries lens, and then be able to engage in a dialogue and a discussion with all of you. I brought two, I'll use the word lifelines. I don't know what the right term is in Zoom talk with me. So I have Craig Blackwood, who is our Deputy Director for our Occupational Safety and Health Programs, and he'll be probably the best position to be able to answer any of the detailed questions that you have on worker safety. And I've also invited Tammy Fellon to join me, and Tammy's role is both intergovernmental and working with the legislature, and she's been leading our effort and coordinating the work that we've been doing with other state agencies and trying to put together the industry-specific reopening plans. And so she can be able to answer some of the questions if things come up about a particular industry. Before getting into some of the specifics around workplace safety, what I wanted to do is just to take a step back, and for those of you who haven't had a lot of interactions with L&I, just sort of walk you through a little bit about the kind of places where our role and our mission touches the crisis that we're all facing. So we provide a variety of different services across the state, and so our mission statements is helping to keep Washington safe and working. And probably in the scheme of things, we administer 30 or 40 different programs, depending on how you count them. But if I were to sort of bucket them, there's sort of two primary ways that I would bucket what we do. The first is we're in the business of preventing bad things from happening to people. So if you think about workplace safety, what can we be doing in partnership with you, in partnership with businesses, in partnership with worker advocates to prevent accidents from happening on the job? We're also in many of your counties, the state's electrical inspector, the state's boiler inspector, the state's elevator inspector, variety of different things that we do there. The second sort of bucket of work that we do, I would put into what we describe as the recovery category. If something bad happens to somebody, what is it that we can do to be helping? The place where that's probably the most apparent is we are the state's workers' compensation insurer. So we are a $2 billion plus insurance company. If you just compared us to others, we would be one of the top 10 largest workers' comp insurance companies in the country. And then there's a variety of other recovery activities. So we enforce the state's labor laws, paid sick leave, minimum wage, overtime. So when workers believe that they weren't getting what they're entitled to, they come to us. And that's, you know, high level, that's the kind of work that we've been mandated to do. So each of those buckets winds up taking on a role in the COVID crisis that we face. Probably most interesting to all of you is worker safety, and I'm going to spend a few minutes on that. But we've also been working on accepting and processing workers' compensation claims associated with COVID, helping to interpret the state's sick leave laws as it relates to COVID. And more recently, we've been taking on a role in partnership with other state agencies of enforcing the governor's Stay Home, Stay Safe initiative. And we can spend some time talking about what role we're playing and what role we're not playing there. And I think that may be important, because my sense is there's probably many rumors out there that probably aren't true about the enforcement role that we're taking on. But let me start with probably what's first and foremost on your minds, which is safety. And let me start by saying that one of the things that has been a real challenge, I think, for all of us, is we know that COVID-19 is a disease that easily spreads and puts us all at risk. And what we have been striving to do since the beginning of the pandemic is trying to identify what are those things that employers can do to prevent the spread of the disease for workers. We've sort of hit upon 5 basic components of what we think an employer needs to be able to be doing to stem the disease in the workplace. And a lot of these are sort of good practices, whether you're an employer or if you think about yourself as a member of the public. So sort of quickly walking you through, I'm going to quickly walk you through those 5, and masks absolutely do tie into one of them. The first is what we're hearing the most on, which is physical distancing. Because of the nature of how this disease is spread, the more we're able to maintain a distance of 6 feet or more from others, the less at risk we are of spreading it from one human being to another. And so what we've been encouraging is employers to look for every opportunity they can to redesign work so that people stay 6 feet apart, to look for those opportunities where people can telework so you don't have as many people in the workplace. Recognizing that there are places where even being 6 feet apart may not be possible, what we are then saying is, if you can't do that, identify using a term of art, engineering controls. What are those things that you can do? And think about sneeze guards. All of us have been in grocery stores. A lot of the grocery stores are now putting up sneeze guards to prevent the spread of the disease when folks have to be closer than 6 feet apart. An added element of that is what Eric mentioned a moment ago, which is masking. As we begin to move through the governor's phases of reopening, and we're spending more and more time interacting with each other, we've identified the need to ensure that as we're out in public and in the work setting, that we're protecting ourselves from the disease, but also protecting ourselves from spreading the disease. And that's sort of the spirit behind the science behind requiring an expectation of masking. And what we've done, again, we can spend some more time talking about this, is sort of identifying the level of either a facial protection or a mask that would be needed based upon the amount of time that you're spending in close proximity to others. So if you're working alone, there wouldn't be an expectation for masking. If you're not working alone, but you're spending very little time within that 6 foot bubble, the expectation is to wear a cloth mask or a bandana or something that provides a degree of protection. And the important point there, what the science is suggesting around masking is the cloth masks do a decent job of protecting you from spreading the disease. Because one of the things we're finding is a number of people who have COVID-19 are asymptomatic, meaning that they're sick and can spread the disease, but people don't know it. And that's why we're seeing such an emphasis, both here in Washington and across the country, on masking. Second piece that we're asking everyone to focus on is hand washing. So the germs are getting on your hands. We naturally touch our face. The more we're washing our hands, the more likely we are to prevent the spread of the disease. The third is sanitation, and that's sort of a fancy way of saying, think about those things that you touch and other people touch in the workplace and clean them regularly. The fourth thing that we're expecting employers to think about is what is your plan in case one of your employees is sick? And how do we ensure that if that happens, that you're cleaning the area that they've worked and you're quickly removing that worker from the workplace so the disease isn't spread. And then the last piece is an emphasis on an expectation of training. That the more knowledge, this is sort of that classic example of where knowledge is power. The more knowledge that you have about the disease, the more that workers know how to prevent the spread, both when they're in the workplace and at home, the more likely we are to be able to prevent a second significant outbreak. So those are sort of the general expectations for all employers. Then what we have been doing in partnership with a number of other state agencies is looking at and providing some guidance to trying to figure out how do those principles apply in different industries. Because what I just described is very different in a retail setting than a manufacturing setting, than an agricultural setting, than a construction setting, and trying to provide some specific expectations and guidance in some of those industries. So big picture, that's been the emphasis that we've been focusing on worker safety. Eric, let me ask, I can sort of go on to other topics, or based upon the interest of your members, should we stay on safety first?
Yeah, let's stay there. I'm off mute, make sure. What was the second one? Engineered?
So it's
physical distancing was number one. Engineered distancing. What was the terminology?
Is the first, and we'll get you a one page. We have some one pagers on our website, so what we'll do is we'll send that to you so you can get it out to the membership. But the basic
that'd actually be perfect.
So the buckets are social distancing, and sort of subsets of that are engineering controls and masking. The second is hand washing. The third is sanitation. The fourth is a plan for people who are sick, and the fifth is training.
Great, perfect, thanks. Let's actually, because there are some questions that are popping up into the chat box. So let's take those a little bit. Could you, and that will allow a few folks to unmute themselves as well. Maybe staff can help me make sure we're tracking the participants and who's raising their hands. So could you talk a little bit about protocol if someone has an underlying medical condition and cannot wear a mask?
Sure. So there are certainly, there are certainly circumstances where for the safety of the worker, they have a disability or an underlying medical condition where wearing a mask is not appropriate. And in those cases, what we would ask is that a worker notifies their employer, has some sort of documentation from a medical provider, and that's in essence what we're looking for. Craig, let me ask, is that if you're on and can unmute, is that a fair way to describe it, or would you add some more context?
Yep, might add a little bit more.
Great.
Can you hear me?
Yes.
Yeah, go ahead, Greg.
Does my box still say I'm Joel Sachs also?
It does.
It
so
does.
Joel Sachs is.
Okay, I haven't taken over the agency, and what I don't think is how I logged in. So I turned my picture off so you wouldn't be too confused. The real Joel was talking with his picture. Yeah, no, Joel described it well, and it also goes into the second question. So we're kind of building the plane on this as we go, and we're meeting internally, and we're looking to get some solid guidance. We're getting these questions asked from numerous sources, and we will be working over the weekend to get the final guidance and hope to have something published on Monday when all this goes into effect. So stay tuned for the latest, because this stuff changes by the day. As Joel described, it is accurate. And if you'd like, I could go to the next question that actually disappeared.
Yeah, where do you want to?
From Janet about the large.
Yeah, from Commissioner St. Clair is working in a large space with 6 feet or more of separation, often within cubicles and without much shared space interactions. Are masks still required? And I might add something to that is we've had a lot of folks that have put up and spent a lot of resources on plexiglass at counters, barriers, and to assure that they wouldn't have to wear a mask. And so talk to us a little bit about mask wearing in the office environment, and how this has somewhat changed between the CDC rules that initially came out to what L&I might be publishing now.
Yeah, as we've gone along for the last 2 to 3 months, the CDC, we're trying to track that, and that guidance changes, and we try to stay current. And we have gone from sharing guidelines to now requirements and enforcing things. So things got a little more serious as we've gone along. But we do try and stay in line with the CDC guidance. That's kind of our go-to. And this very question on the cubicle space, again, building the airplane while we're going. So I'm gonna just share some thinking. This is not a final decision, but the questions we're getting is in the information that's out. When you read it, it says employees either have to wear a mask or wear a mask without working alone or something along those lines. And so we're getting asked quite a bit, what does working alone really mean? Is that all by yourself in the middle of nowhere, or just is that in an office where there's protection, barriers and cubicle walls? And so our thinking right now is for the question of working in a large space with 6 feet of separation, with cubicles and walls at certain heights, we likely, our guidance would not require masks right then because you're socially distanced, but when you move from your cubicle and go into areas where you don't really have control of the environment, and you can't socially distance, then you would wear a mask. And that is, again, a little bit different than what the Department of Health had put out. I don't know if anyone from the Department of Health had called in, but I believe they had something that gave a blanket statement, you have to wear a mask all the time in the office. And we're trying to back off a little bit from that, to understand what's going on in the real world and how we can be safe and still get our work done.
So let me.
What was the height of the cubicles that you were suggesting? Because I know we in certain office spaces may have just 4 foot cubicle height, or more open, but still definitely in cubicles.
Yeah, the idea with the cubicles is it's all about droplet transmission prevention. So it really depends on how you're set up. It needs to, we would believe, go down at a normal head level when you're sitting down in your cubicle. That could be 5 or 6 feet. It's really dependent, but it's blocking transmission is kind of what we're looking at.
Okay.
So if I can, just a couple of broad things. One, and let me step away from the masking for a second. And I want to just share one of the things that I know is frustrating for employers, and honestly, it's frustrating for us, is sort of one of the basic premises of workplace safety and health rules is the idea to really be able to spend the time to be able to hone the rules, to be able to ensure you understand the unintended consequences, and that you have the timing to be able to educate everybody on rules and expectations. I mean, the more that you have general knowledge and understanding of the why and the how, you generally have wonderful compliance. Contrast that with what we're facing in this crisis, which is there is no luxury of time here, because we're not in a space, we're in a space where the need to reopen is great, and we want to do that as quickly as we can. At the same time, we're still learning about how the disease spreads. Our knowledge today, particularly about the fact that asymptomatic individuals are spreading, and it's probably more we as a source are spreading it rather than necessarily drop other ways, significantly changes some of the interventions. So part of what's happening is we as a society are learning as we move through this crisis, and trying to err on the side of trying to protect ourselves, protect coworkers, and be in the space where we can begin to reopen more and more. So I get that there's a lot of very challenging, conflicting values that make this incredibly hard for all of us that are sort of in this space of being public officials. As it relates to the office environment, I think for me, the thing that I've really gleaned is the idea of wearing a mask when you're not in, when you have the potential of having shared space sort of shared air with somebody. So the idea of that cubicle, you really have a container of having your own space, and the idea of droplets spreading from one to another is going to be less than when you're in sort of an open space environment or walking back and forth. So sort of my rule of thumb, and the way I've been explaining it, is when you're sitting in your office, when you're sitting in your cubicle, if the walls are high enough in your cubicle, it would be okay to take the mask off. When you get up to walk around, get up to go to the restroom, put your mask on. And I think overall, the more we're airing and encouraging people to wear masks, again, move away from the requirements, the more we're seeing that as a good basic safety measure, whether you're in a workplace setting or just out in public in general. And as we learn more, we may need to be adjusting one way or the other. So again, I recognize the frustration with the fact that there's some degree of ambiguity, and we don't have the clarity to answer every question that we would want to be able to answer. And the more you're raising the questions, the more it's helpful for us as we think together about how to continue to tweak what we're thinking about to provide the greatest amount of protection in the clearest possible way. So the questions that you have in the chat are great, and I just ask for a little bit of recognition that as we're working through this, there may not be the clarity and the specificity that we're used to giving on worker safety issues with everything that you're raising.
Great, thank you. There is a hand raised. So Commissioner Hutchings, who is with Thurston County, if you want to unmute yourself, Commissioner, and to go ahead and ask your question, then we'll come back to the chat box.
Thank you. I threw in the chat box. This is about if an employee refuses to wear a mask, but also how do we enforce the public coming into the building if they refuse to wear a mask? And how do we address the issue of volunteers?
Okay, so let me take a first run, and then Craig, Tammy, jump in. So as it relates to employees, our expectation is that you would enforce this the same way you would enforce other safety rules. That an employer has basic expectations. You know, the example that I've been using is fall protection in construction. It's simply not acceptable, and I don't think anyone would say it's okay for someone to say, a construction company would say, if you don't want to wear fall protection, that's fine. We hold our employees accountable for productivity. We hold our employees accountable for customer service. This is just another place to hold our employees accountable. Second question, as it relates to the public, I want to be somewhat careful here. Because that's a space that wearing the regulator hat, that's not a role that L&I plays. So our regulatory role has to do with employees, not the public. Wearing sort of that broader hat, I think the more that we are encouraging, and what the governor's proclamation talks about is that businesses are strongly encouraged to ask customers to wear masks, and I think that as public employers, we're thinking about the same thing. So as an employer, I've been having conversations with my own team about how and where can we be strongly asking customers to wear masks, and if they don't, are there ways that we can change some of our business processes so our own employees can be protected while citizens are able to get the services that they need. So we're going to be doing everything we can to say, when we open, if you're going to come into our offices, we need you to be wearing a mask, and if not, let's identify some other ways that we can get you the services that you need.
All right, and I would imagine volunteers are almost acting as pseudo employees, but volunteers in our offices, same thing.
Craig or Tammy, you want to take that one?
Yep, this is Craig. I will take it. So our jurisdiction really applies to employees only. Only volunteers if there's some kind of compensation for them. So technically, we might not be able to enforce it for volunteers, but in reality, it would make no sense based on the reason the masks are being worn to prevent transmission from one to another, that the employer would not treat them the same way. Whether we can enforce it or not, that is one question, but should it be done? Yes, regardless of whether we can enforce it or not.
So, Craig, this is Tammy. Apparently, I appear as Joel Sachs as well. So Joel's really popular in this meeting. When Craig said, unless there's compensation, yes, that's true. And my understanding, subject to Craig correcting me, is that one form of compensation is if you cover them for workers' comp as a volunteer for the medical portion of workers' comp. So I don't know how many of you choose in your county to do that, but that could then also extend the safety and health requirements to those volunteers as they provide service in your facilities.
Because the auditor has a ton of volunteers come in for elections too. Several. Thank you.
Great, thank you. There is a question, I'm going to stay in the cubicle environment here, from Lisa Young over in Kittitas County. What about the impact of ventilation over cubicles, and can the air spread the virus from cubicle to cubicle? And I know there's been a lot of discussion about air and air handlers and air movement. Any comment or guidance?
So Craig, I'm going to ask you to tap into your hygiene expertise and answer that.
Yep. Tap into my Zoom expertise and get me off mute. So I think I did it. So there's so much unknown. There's a lot of research. So the answer to the direct question is really don't know enough to give a definitive answer. In general, yes, ventilation can move things around. The air moves, and that's how particles and droplets can move. But in general, when you're speaking droplets, they're fairly heavy and they don't stay in the air too long. So they're likely, when they're moving, to fall out. So it's not real likely. I know, and I think Joel hit on it, we're an employer also, and we want to have a safe environment for our staff. And once we get back to coming into the building, I know we have more maintenance planned, filter changes. The real key, I think, is maintaining ventilation, so clean air is coming in. And I don't know there's really much risk of the ventilation moving stuff around in the building, because it's just too heavy. That's why the hand washing and surface cleaning is so important, because things are more likely to wind up on surfaces than floating through the air for a long period of time.
Great, thank you. There is, this is always an interesting question, because it creates a strange dynamic where it's oftentimes easy for counties to hold the employees accountable to follow L&I rules. It's not always easy to have the elected officials who believe they are independent follow L&I rules. It adds an interesting dynamic to us. Any thoughts or guidance? I'm not sure. It's oftentimes more of a political question, but any regulatory guidance for us?
Craig, I'll let you go first on the regulatory part, and then I have a different lens.
Okay, so the regulatory part for elected officials, it's an area we don't have jurisdiction over, so we cannot make them do anything. But we tell everyone, especially in leadership positions, to set by example. So again, it's one of those things we can't regulate or enforce, but we would strongly encourage leaders to be setting the example. That's just my words there at the end, not department words. And so now I'll turn it back to Joel. The other Joel.
Yeah, you stole my thunder, Craig. Again, there's sort of two lenses here. We can answer the questions, what do we expect as the regulator? But sort of the basic belief that I have is what we do at L&I and what we do sort of across the country in OSHA is that those are really minimal standards. When you talk to people about what is it that they did to create a safe workplace, most people don't say, hey, what I did is study the rules. They talk about how they cultivated and created a culture of safety in their organization. And that really starts from the top. And so because we know of the dangers and the risks associated with COVID-19, my plea to all elected officials would be, people are watching what we do as leaders, particularly what you do as elected officials. And the more you're demonstrating the reason that you're wearing a mask is to protect your loved ones, because in many ways the masks, the cloth masks may not protect you from getting sick, but it certainly reduces the likelihood that if you are sick, that you would spread that to somebody else. And so that's really the spirit behind which we're hoping that everybody takes this, for the same reason that we're hoping that through the education campaign that for the most part, when the public comes to interact with us in our official capacities, that they would be perfectly comfortable and willing to wear masks because they realize that they are a potential risk of spreading the disease.
Great, thank you. I want to, I think the question was asked, and I just want to confirm this, is that there's a question about whether or not, consequences for an employee that refuses to wear a mask was, you should treat that similar to any potential violation of a policy. For example, if your policy was an L&I and they had to wear a hard hat, or safety boots, or safety vest, or any of those requirements, and they refuse to, you would treat that like any disciplinary action, performance correction.
Correct. That would be our guidance. That would be our guidance,
Great.
that you would be holding your employees accountable in the same way that you do today for safety expectations. Craig, is that a fair way to describe it?
Yep, that's very fair. You got it right.
Yeah. Let's see, there's still a lot of mask questions, but I want to go back to one similar to a cubicle one. Let's not leave that one first. And that was because we have had a number of counties, particularly in the customer facing arena, for example, at a auditor's office where they deal with elections and recording and licensing, where they've installed plexiglass as a barrier, that kind of that engineered control. But that if it's less than 6 feet, the concept was people have been told that you would still need to wear a mask versus if it was more than 6 feet or some sort of barrier. So could you just highlight a little bit about that?
Craig, go ahead.
Yep, and the 6 feet is the key. If you have barriers to protect from the public or each other, however the work they're doing. If you're within 6 feet, you still need to wear a mask because you're not working alone. But the key to not wearing a mask is if you're working alone or not. And again, that's the definition we're working on as we kind of build this thing.
And the height of plexiglass. So if you are a customer service person at a counter, how high does that plexiglass need to be before you don't need to wear a mask? 6 feet high? Forget about the social distancing of 6 feet separation. There may only be 3 feet between the two of you, but there's a piece of plexiglass there. How high does that plexiglass need to be?
So again, I'll do my best to give an answer. We're kind of working on this very thing. And if you're not 6 feet apart physically, the mask needs to be worn. If you use barriers, because again, if you see the grocery store barriers, they're all still wearing a mask. They're not 6 feet apart, and a little bit different. But again, we're trying to figure out what exactly working alone means and when do you not need a mask. But for now, 6 feet or closer, regardless of engineering controls, masks are needed. We're really looking at once you're over 6 feet away, then what do you need?
So Eric, this is Tammy. One thing that
Go ahead, Tammy.
One thing that Craig helped teach me just a few hours ago is that what we're trying to do is control the breathing space between people, right? So when you think about, like, the grocery store example was actually one that Craig used with me earlier, because he thinks I'm trainable, that the plexiglass actually ends very closely, in a way that allows the customer to sort of reach around it, and so in that proximity, because the plexiglass is not separating out the breathing space, it's not a sufficient barrier, right? For example, the other thing that the Craig's staff was trying to impress on me was, like in a bank, all the banks, and this might be the case in an auditor's office as well, put a plexiglass between the the public coming in and the employee behind the counter, but you also have to remember you have multiple employees behind the counter. And so there isn't a barrier between those employees behind the counter. So therefore the mask, the need to continue to wear masks behind the plexiglass, if that helps at all.
Sure. Yeah, it might. Where you might see you might see a county make a choice to close every other station to provide that 6 feet of separation between employees, and somehow try and create a 6-foot buffer in addition to a plexiglass shield as well. So this is all good feedback. I think folks are just trying to figure it out, because a lot of folks are starting to realize that, we put up a lot of plexiglass and then realize that did we really have to do that if we just should have been wearing masks, and did we spent a lot of money on plexiglass?
And Eric, let me say, I still think that those were incredibly important, because what we have done is talked about the different type of facial covering that's needed based upon the distance. So a lot of what we've been talking about here are cloth masks. The cloth masks are when you basically can socially distance. So in the scenario that you're describing, where folks are closer than 6 feet, absent some kind of engineering control like the barriers, the cloth mask would actually, in and of itself, not be sufficient. And it would have to be sort of a higher level, a dust mask or a higher level of protection. But Craig, correct me if I'm wrong here, in those scenarios where you have an engineering control and you're within 6 feet, that may allow somebody to wear a cloth mask, where absent those engineering controls, a cloth mask would not be sufficient. Is that a fair statement, Craig?
Yes.
Okay. So it does certainly provide more options of the type of mask that an employee can use if you've invested in some of those additional protections.
Okay, great, thank you. There's some questions in here as well associated with distinguishing between an employee who refuses to wear a mask versus one who is medically unable to, and where does a reasonable accommodation and the ADA come into play?
Go ahead, Craig, you want to take that, or you want me to?
So, well, I could give it a quick start, because this is another one of those very questions we're working on to get the standard response out on Monday to be sure we get it right. But we do understand an early question. Somebody mentioned claustrophobia, and there's many other medical reasons someone might not be able to wear a cloth face mask. And I think the early question was, will a face shield be okay? It really does get into a reasonable accommodation. They can't wear it, and we're gonna give some guidance on that. But medically not being able to wear it is much different than an employee just choosing not to do it because they don't want to. But the reasonable accommodation is gonna be, I believe, the route we'll recommend. So.
Okay, great. So we have a couple other questions around oxygen, hot weather. So all of a sudden we're gonna have a number of our county employees, either whether it's in the parks, road crews, et cetera, that will be out in hot weather wearing a mask. Is there any concern about any dangers or any guidance that's going to be around being outside with certain types of masks on, oxygen levels, suffocation, anything like that, and anything around temporary emergency under the phases and the stages? So we're, a number of our counties are in phase anywhere from 1.5 to counties that are now moving into phase 3, and we will have counties maybe in 3 weeks even going into phase 4. What happens within those jurisdictions in regards to masking?
Craig, go ahead.
Okay. So I'm going to answer the oxygen one and the heat one, and then I'm going to the phases one. Yeah, I'm not sure on that. That's really a Joel question. So on the oxygen, so first keep in mind all the time. There are many employees who daily wear respirators and other kinds of things on their face that are much more tight fitting. And oxygen levels are fine. So oxygen is not an issue wearing a mask. The oxygen is fine. What can be an issue is the medical stuff we mentioned. If you've even worn a cloth mask, you've noticed, I think, when you come out of the store, if you take it off, your breathing gets much easier. There is some resistance there. So the real risk to some of the masks are not the oxygen level, but putting extra stress on the person wearing them if they're not medically capable, which again is why we allow cloth masks and surgical masks, things that many more people could wear comfortably. So no concerns on oxygen level. And then the heat, we've already gotten this question from our agricultural community, and let them know, because we do have heat stress rules, and putting something on your face could maybe increase your temperature a bit. But in general, many ag workers and other outside wear bandanas all the time currently to protect from dust and other things. So there's not a huge concern with heat, but we're definitely tracking that. Our heat stress rules, there's some clothing. If you're wearing certain kinds of clothing, you can't be out in certain temperatures for as long. And we don't believe the cloth face coverings or surgical masks add to that load. So we're watching it, but right now they're uncomfortable for sure, but hazardous, we don't believe so.
Okay, great, thanks. So if 6 feet is the key, then as long as people can stay 6 feet apart, there is no mask requirement?
No, there still is a mask requirement. The key is working alone. The 6 feet demarcator is the type of mask that would need to be that would need to be worn. So if you are 6 feet apart, then a cloth mask is fine. If you spend more of your time in closer proximity than 6 feet, then a cloth mask may not be enough, because again, the cloth mask is really designed to prevent you from spreading the disease to others. If you spend a lot of time within that 6 foot bubble, then you may need some protection so that others aren't making you sick. And so we have on our website, and we can send you sort of the guidance that a document that we put out, what mask for what task. And the underlying spirit behind that is when there are no other engineering controls, here's the level of masking that's required. And it really goes from the cloth mask when you basically are able to stay within 6 feet to folks that are working with folks with active COVID really needing to wear the N95 masks. And there's a series of specifics within that continuum. But the more that there are those other engineering controls, the plexiglass that we've been talking about, because that provides some protections, that would allow you a greater flexibility in what kind of mask is acceptable. So in an environment where you've put up the plexiglass, you may be within 6 feet and be able to use a cloth mask. Take that same situation, remove the plexiglass, and what may be required are going to be dust masks or surgical masks to protect your workers. So it winds up being a combination of what have you done from an engineering perspective, and how close are people going to be to each other. And the other question that we haven't addressed yet, Eric, that you asked about, is at what phase does the masking requirement go away? And we know that it's not going to, and that's something that we're still needing to work. We're still working our way through. So as of today, the masking requirement applies regardless of the phase that you're in. As we begin to learn more, and as we begin to progress our way through the reopening and seeing what happens with the reopening, that will be something that the public health officials and the folks at L&I will need to be assessing. At what point does it make sense to begin to make some adjustments? So it's too soon to tell on that, but we recognize that that's a conversation we're going to have to be having as we move forward.
Great. Well, we appreciate that. I think, this is I would say a really important message is we are, you're going to have counties right now from all 39 counties on the call that are in varying stages of the variances. Counties that have submitted their phase 3 and in 3 weeks likely will, if they continue to have very little COVID-19 activity, will be prepared to move into phase 4. And we've really been asking the governor's office to have the guidance ready when the 8th entity is moving into that phase. And so that might be something that you can work with Department of Health on in particular, as in 3 weeks, counties potentially could move into phase 4. So, which is much more open, and it won't be the large urban counties for sure, but it will be a number of our 10 counties that first entered this. So I think we're good.
Right, and,
Yeah,
I
thank you.
think the question that we all need to grapple with is, the good news is we're back to sort of some semblance of normal. The flip side of that is there's much more human-to-human, face-to-face contact. And as we're thinking about masking as one of the primary ways of preventing the spread of the disease, when we're in phase 4, is there actually a heightened need in some ways for the masking, at least for a period of time? And as we sit here today, I don't have a good answer to that, but I think those are the kind of policy questions that we're going to be needing to grapple with in the weeks to come.
Okay, great, thank you. Let's see, there's another question. I had one more I was going to lost. Oh, well, do you have, or have you developed, you talked about wear the right mask. Is there a good like decision tree, grid, chart, graphic that will be available to be in the workplace that really accurately describes this, so that as an employer, we can post something, we can enforce it, we can point to it to say, you know, these are the rules that we're abiding by, this is the rules you need to abide by, similar to many of your other charts that and graphics that we can post.
Yeah, absolutely. As of today, that we have 2 publications on our web that Tammy is going to be able to put into the chat. The first is a one-page chart that sort of walks through a variety of different scenarios, from pretty much working alone to working with somebody with a confirmed case of COVID, and what's the level of masking that's required. So that's sort of in a chart form. We realized that may not be the most helpful for everybody. So we also published and have on our website what we're calling Pick the Right Mask for the Right Task. And that's sort of a more plain talk version of the chart that provides some pictures and some more examples, and is really meant to be a guide so that an employer and a worker can think about their particular set of job tasks and assess, is a cloth mask sufficient? Is it a surgical mask? Is it a dust mask? Is it a KN95? Or is it something else? So that is available, and it really was designed for somebody who's not necessarily familiar with worker safety requirements to be able to read that document and try to place themselves into one of those buckets. And so I think they're
Great, thank you. I think
both in the chat now.
Yeah, Tammy has posted both of the links to those, so appreciate that. What about the use of a face shield versus a mask? So if someone, for example, had that claustrophobia and wanted a face mask versus a face shield versus a mask, what's the decision tree associated with that?
Greg, I'm gonna have to turn to you again.
Yep, and so we kind of touched on this. So if the question is just, is a face shield acceptable alternative for a mask, the answer is no, because the idea with the mask is it's at least somewhat tight fitting, and so stuff doesn't get out, whereas a face shield has openings at the bottom and on the side. However, as part of a reasonable accommodation, if somebody can't wear a mask and they might be able to wear a face shield, that might be a decision to make there, because something is better than nothing. But in general, the answer is no, a face shield does not substitute for a mask.
Okay, great, thank you. There's something in the chat box from Commissioner England in Chelan County about the New England Journal of Medicine around masks. So we'll pass that on to you to take a look at as you're making decisions around that. I did indicate the correction to what I had said earlier, is that those jurisdictions that are moving into phase 3, there is no specific time frame for when you'll go into phase 4. So the 3-week time frame no longer applies. So thanks, Ed from Lincoln County, for clarifying that. I appreciate it. Is there any is there any participants that have their hands up? Doesn't look like it, and the staff lets me know otherwise. Commissioner St. Clair, you want to unmute yourself and ask your question? That would be great if you could do that and explain that.
So we've had our chambers doing consistent messaging on these guidelines as we've moved into reopening to local businesses, and our businesses in general have been just wonderful and compliant. They've had conversations with one business consistently, another seems to be finally getting the message. What do we do with businesses that refuse to follow the guidelines and just basically, even with direct conversations that they've had with those businesses that don't want to participate in this safety issue?
So, Commissioner, I want to thank you. I think the way you lay that out is perfect, because I think the more we're able to use moral suasion and focus on, hey, this is something that we're doing for the good of the community, I think that's how we gain the most understanding, the recognition of why and compliance. So I think we have to be starting with the why and starting with, hey, this is the norm and this is moral suasion, and particularly things coming from the Chamber of Commerce, I think is incredibly powerful. There always will be a small, and I do believe a small number of outliers, yeah. And there is a role for labor and industries there. So what we're talking about in terms of the requirements, where necessary, have the enforcement authority where if we do get a complaint from a worker, we do get a complaint from another business, we will be able to contact employers. We will be able to, and will be where necessary and appropriate, engaging in using our enforcement tools. For the most part, we believe the best way to get compliance is education, outreach, having these kind of conversations. But at the end of the day, as a regulator, there are tools that we have at our disposal.
Can community members, or I know that we're a small community, so I don't think that the folks who are trying to do that moral persuasion and peer pressure necessarily want to, I think they only are inclined to report if they can do it anonymously. And I've looked at that form trying to figure out what their options are, or our options are as government. Do you have any thoughts about that?
Craig, Tammy, you want to go first and then I'll jump in?
Sure, I'll go. I'm not sure exactly what form, but anyone is welcome to contact us anonymously with information. There is no requirement that a name be provided. The only downside is if we have a name and contact information, we can follow back up with that person to let them know what the outcome of our work was. Or if we have other questions, we could call them if something isn't clear. But sometimes remaining anonymous is the most important thing to people. And we have no problem taking that information anonymously.
And
great, thank you.
Include contacting us. And there's also the portal there's also the governor's portal for reporting a business, where someone believes that they're out of compliance, and anything that's connected to worker safety, what's happening is the governor's office is forwarding that along to us. What I would say, just to be fully transparent in terms of how we prioritize our regulatory resources, our top priority will always be a worker complaint. When a worker says I'm not safe, that's always going to come to the top, higher to the top of the list. And that's, now that being said, if we get something, again, take it out of COVID, when we get a referral from any of you or any of your employees saying, I'm driving by a construction site and I see somebody not wearing fall protection, we get on that pretty quick, because we know that that's an imminent danger. So a lot of what we're doing on our side is based upon the number of complaints that we're getting in. We're trying to triage and focus on the most serious risks as quickly as we can.
Are face masks with vents okay?
Craig, another one for you.
Yeah, we've had this discussion internally as well, since the whole point of the face mask is to prevent stuff from being expelled. And so the exhalation valves kind of defeat that purpose, because the purpose of the exhalation valves make it easy to breathe as you exhale, also lets stuff out. But in reality, if we see things with exhalation valves, we're going to be fine with it unless you hear otherwise, because the requirement is, when you look at DOH, you have a cloth or something to cover your face. It really doesn't go into specifics. So there may be a little risk with exhalation valves, but much better than not having a mask at all.
Great, thanks. So there is, and I'm going to butcher it, and one of the members may want to, a question came in, I think, earlier before here, and that was regarding face coverings and concealed weapons. And I don't know if one of the members can clarify what that means, but I think it is illegal to have a face covering and carry a concealed weapon. Is that what the question was? So I don't know if someone wants to unmute themselves and ask the question. So I'm probably getting it wrong, but I don't know if anyone at LNI has familiarity with this issue.
So this is Wes McCart from Stevens County. Can you hear me?
Yeah, go ahead, Commissioner McCart. Yeah, go ahead.
Yeah, that's what I have been told, and that is my understanding from those folks that have concealed carry permits, that it is illegal to cover your face in concealed carry. So it's kind of contradictory with you must cover your face, because a lot of employees, especially in rural counties, are carrying concealedly.
So I am not familiar with that. Craig, Tammy, is that something that you've run across or heard about?
I know, I'll let Tammy respond. I know the question's been asked, but it's kind of beyond safety and health, so I do not know the answer to that. I don't know if Tammy has information.
Right, I have been, what I understand is that we did get the question. Melanie actually shared it with us, thanks Melanie, about that it seems to be the requirement for a mask appears to be in violation of that concealed weapons requirements. And so we are still taking a look at that. While it seems like a lifetime ago, we got the question on Tuesday, it looks like. So it's something we're trying to sort out. We don't have any expertise in the concealed weapons permit arena, and so it's a bit beyond us. But we're trying to sort that out. And Melanie did share the question on behalf of your members, but I didn't. We don't know the answer yet.
Great, thank you. Thanks, Tammy. We also had contacted the governor's staff, who hadn't heard anything yet about that one as well. So thank you very much. Is there any additional questions in the participants who have raised hands? I don't see any hands raised. If you do, you're more than welcome to raise your hand, unmute yourself, and ask Joel. And it's a good thing, Joel, that you had phone friends here. Otherwise, we would really be grilling you. So thank you very much for Craig and Tammy for joining us as well. We have really approached our 4:30 hour. So if there is one more or two more questions, we will finish those up. We want to honor your time and thank you for being with us for the entire hour. That is a very, as you can see, a very lively conversation, and I think very important for our members to be here and joining, and obviously a lot of interest in your book of business right now.
Absolutely.
Last weekend was Secretary Weisman was on the hot seat, so we gave him a break for the week. So.
And let me also say, Eric, that if the membership wants, and whether it's a webinar or something else, we clearly gravitated because of the time to masking and worker safety, to the extent that there are questions regarding the enforcement of the underlying Stay Home, Stay Safe initiative, the emergency rule that we published. If there are questions about workers' compensation and the impact on workers' compensation, we're happy to come back and continue to have this dialogue. We believe that we have a responsibility to all of you, particularly as elected officials and county officials, to be transparent, to give you the information that you need. And we recognize that many times you're answering as many L&I questions as we are. So the more that we're equipping you with information and explaining the why, the better we believe it is for Washingtonians. So we want to be as accessible and as available to the association as we can be.
Well, great. Thank you. I think we will take you up on that and probably work with not just our elected officials, but more with some of our county administrators, our county human resource directors, our risk managers, and try and set something up for you to have more dialogue specifically with the technicians that need to speak to each other. That'd be really good.
Happy to do it.
Great. Thank you. Yeah, thanks. And is there who should we put as the point of contact? Who is the lucky winner of, if we have more questions, need more information? Is there either regional individuals that people need to be contacting? Is there a state lead for us to tell people to say, here is the go-to person for more questions that we might have?
So this is the place where there's, every once in a while, there's good news of working remotely. So when I say that Tammy Fallon is running a lot of our intergovernmental work, I know that she's a few towns away from me, so I feel safer saying it than if we were sitting next to each other in an office setting. So I think Tammy working with Melanie is probably the best way to make those connections.
Great, perfect, and we'll do that. So thank you. So Tammy, thank you very much for volunteering to do that. Yeah, great. Thanks, Tammy. Great. Well, thank you, all three of you, very much for joining us today. And in the interest of time, we will leave our meeting here in just a few minutes. So you're more than welcome for our closing remarks. Melanie, do you have anything you'd like to add? And then I will remind folks that you should be getting invitations from us either later today or tomorrow for our Monday and Tuesday calls, our Zoom calls that will deal specifically with our coronavirus relief funds and how counties are continuing to approach the coronavirus relief funding, and then how our counties are approaching their phases in the variances, where we now have counties that are ranging anywhere from about 1.2, 3, 4, 5 up to 3 now. So we have a number of counties that have, I think, received their approval to move to phase 3 as well. So we'll have a call specifically on the variances as well. So I appreciate that, and you'll get information for that. Is there any other quick comments or anything from anyone? You can unmute yourself and feel free to unmute yourself and have the floor. Otherwise, we're going to wish you have a good weekend and the rest of your Friday evening. I'm looking for any unmuted hands raised or chats.
This is Melanie. I just want to say thank you to Joel and Tammy, and the other person signed in as Joel. I know that you all are swamped, and so we really appreciate you taking your Friday afternoon. Joel, nice to see you. It's been a while. And one of the other questions that, it's not really a question, but just something that I'll mention because it's come up a lot with our local public health officials, is businesses reaching out to them and saying, here, approve our plan. And, they don't really, one, have the know-how or the resources to do so. So being able to direct them to the right place is certainly very helpful when, they know how to inspect a restaurant, for example, but not necessarily a retail boutique. So we appreciate the work that you all are putting in.
Melanie, thank you. And that's actually a really important message to leave on. Unfortunately, many times when people think about LNI, they think about LNI, the regulator. We have another side of the house. We have one of the biggest consultative programs in the country where where part of the workers' compensation premiums that businesses pay come back to us, and we've hired consultants whose full-time job it is to help answer questions and help businesses figure out how to establish their safety programs. So we've been getting a number of questions in from businesses, and we're committed to continuing to help them and give them counsel and advice. So please, as those of you who are getting those questions, ask them to contact us, and we're happy to work with as many businesses as we can, because what we believe is most businesses want to do the right thing. Most businesses care about their employees and want them to be safe. And if there's something that we can do to help them figure out how to make that happen, that's how we should be spending our taxpayer dollars.
Thanks, Joel.
Great, thank you. All right, well, we're going to sign off. I appreciate everyone's participation, and we really do hope one more question in here. The first rule to verify an adequate mask seal in industry is to require a clean shave. So Joel, you're gonna need to shave, it looks like. No, but is that addressed within the context of the rule? Craig, one more, and then you're off the hook for happy hour.
All right, I like the last part of that.
Yep.
So there's confusion. This whole world of mask wearing is new, and it's getting confused with the old world of wearing respirators. So if you're wearing a respirator to protect yourself from a workplace contaminant, asbestos, other stuff like that, yes, you have to be clean shaven to wear that respirator. You have to be fit tested. In regards to the mask now, no, there is no such requirement. If you have a big beard, stuff doesn't fit as well. But again, it's for preventing stuff from going from the wearer out, not from harmful stuff coming in, which is the difference.
Gotcha. Great. Thank you very much. Have a good weekend, everyone. We will talk to many of you again on Monday and Tuesday when we have calls at noontime. So schedule your lunch hour, bring a brown bag, run to your favorite drive-through, and join us on both Monday and Tuesday for lunch, where we'll talk about both the Coronavirus Relief Fund and the phases, county variances. So have a good weekend again. Joel, Tammy, Craig, thank you very much for joining us. Appreciate it immensely.
Absolutely.
And we'll talk with you all soon too. Yep.
Absolutely. Thank you all and have a wonderful weekend.
Right. Bye-bye.
Bye.